Hello, everyone. This is Dr. Handwara again. I'm here with Dr. Alex Manjarian. So this is a continuation from the last time. Last time we talked about orbitofrontal cortex and its function, its role in patients with depression. We'll just summarize what we talked about the last time. So the orbitofrontal cortex, its main function is to assign a rewarding and an affective value to the stimulus that it receives. And it receives different kind of sensory stimulation, including visual, auditory, stimulation regarding face, touch, texture, etc. By assigning a rewarding and an affective value, it plays an important role in regulation of emotion, or what we call as affective learning. So the main function of the orbitofrontal cortex is to inhibit a previously rewarding response or task, so you can actually switch from one task to the next instead of getting stuck doing one particular task after it has lost its rewarding value. So the orbitofrontal cortex, if it is not able to switch task, it leads to perseveration or stereotypy that we see in patients with frontotemporal dementia or patients with obsessive compulsive disorder. Another function of orbitofrontal cortex is to decode emotions. So it's responsible for decoding affective facial expression as well as affective tone of voice, which plays an important role during our social interaction. So if the orbitofrontal cortex is not functioning well, we will not be able to read people's emotions, and thus it will restrict the way we interact with people and our surrounding. And a lot of times we can come across as somebody who lacks empathy, or come across as antisocial, right? Not exactly antisocial, but like somebody who lacks empathy. So those are the two main functions of orbitofrontal cortex. And as we mentioned, the lateral orbitofrontal cortex is responsible for processing aversive stimuli, that is punishments, or something that is not very pleasant. Whereas the medial orbitofrontal cortex is responsible for processing reward stimuli. And in depression, we see an increased activation of the lateral orbitofrontal cortex and decreased activation of the medial orbitofrontal cortex. We'll talk about it in detail. Having said that, the orbitofrontal cortex will then transmit the information that it has processed onto the anterior cingulate cortex. So today we are going to talk about cingulate cortex as such. And anterior cingulate cortex is a part of the entire cingulate cortex. So as you guys can see in this particular MRI, which is a sagittal section, I'm going to mark this. So this part of the brain that you see, which is right above the corpus callosum, that's your cingulate cortex, okay? So I will shade this. So it is the part of the cerebral cortex that is right above the corpus callosum. And corpus callosum is a white matter tract that connects the two hemispheres with each other. Having said that, the cingulate cortex plays an important role in the limbic function, that is processing your emotions. It's divided into three parts. The anterior one-third is known as the anterior cingulate cortex, right? The one in the middle one-third is the middle cingulate cortex, that is in green. The anterior one is in red. And then you have the posterior one-third, which is the posterior cingulate cortex, which is in blue, right? So there are three parts to the cingulate cortex. We'll talk about all the three parts because they do play an important role in emotional regulation as well as goal-directed behavior, right? Even the motor behavior. So if you look at the posterior one-third of the cingulate cortex, it's called as a posterior cingulate cortex, which is shaded in blue. So we talked about orbitofrontal cortex. So let's talk about the posterior cingulate cortex now. So the posterior cingulate cortex is also written as PCC, that is the posterior cingulate cortex. So its main function of the posterior cingulate cortex is to receive the information from your parietal lobe. The parietal lobe is responsible for processing visual information, right? It's responsible for processing information regarding attention, as well as spatial information, like the spatial location of things, right? So what it does is that this visual, attention, as well as spatial information from the parietal lobe enters into the posterior cingulate cortex. Posterior cingulate cortex then sends this particular information into your hippocampus. And thus, it helps in encoding and storing these information. Thus, the posterior cingulate cortex plays an important role in autobiographical memory. And Dr. Manjarian is going to talk more about the involvement of the posterior cingulate cortex, or the posterior cingulate cortex being a part of the default mode network. And one of the functions of the default mode network is processing autobiographical memory. This particular area of the brain plays an important role, especially when you're talking about patients with Alzheimer's dementia, because this is one of the part of the brain that shows earliest involvement in Alzheimer's dementia. So when you do a functional MRI on these patients, you see a decrease in the metabolism in the posterior cingulate cortex. Now, apart from the posterior cingulate cortex, the middle one-third is called as the middle cingulate cortex, MCC. It has different functions, all right? So what happens is that the anterior cingulate cortex usually receives the information from your orbitofrontal cortex, and that information, a part of that information, flows into the middle cingulate cortex. The middle cingulate cortex in turn sends information to your premotor cortex, where usually the planning happens, and then it goes to the motor cortex, and this in turn is usually responsible for what we call as a goal-directed behavior. So the orbitofrontal cortex will assign an affective and a rewarding value, and then it sends that signal to the anterior cingulate cortex, which is responsible for something that we are going to talk about, which is called as action outcome learning, right? It's responsible for resolving the conflicts between competing responses. Plus, it's also responsible for detecting errors during a task performance. And then the anterior cingulate cortex will project to the middle cingulate cortex, which will then project to the premotor cortex, motor cortex, and then you convert the signal into a goal-directed behavior. So the middle cingulate cortex has a variety of different functions. All right. It also plays an important role in patients with catatonia. All right. Middle cingulate cortex also plays an important role in people who have fever or an infection, because this is one of the area that its activation leads to fatigue. So during fever or when you're not feeling good, fatigue helps you to rest your body so that your body can recover, right? So the middle cingulate cortex has different functions. So let's talk about it. So one of the functions of the middle cingulate cortex is cognitive control. CTR is control, as well as executive functioning. So it's responsible for what we call as response inhibition, right? So response inhibition is important because a lot of things we do out of habit or is an automatic behavior, which is not always adaptive, right? It can be maladaptive. So it's responsible for response inhibition. It's responsible for something called as set shifting, that is shifting from one task to the next so that you're not stuck. Plus, it's responsible for what we call as conflict monitoring, right? And you see these things when you're doing something called as a Stroop test, right? So in Stroop test, what you do is you're testing for cognitive flexibility, right? As well as your ability to inhibit a prepotent or an habitual response. For example, they will write red in a blue color, right? So a lot of times when you look at it, instead of actually telling the color, you basically say red because you're so used to actually reading it, but the answer is actually blue, right? So you're trying to recognize the color. So one of the function is cognitive control and executive function, which involves response inhibition, set shifting, and conflict monitoring. Second function of the middle cingulate cortex is to control voluntary, complex, goal-directed behavior. That is goal-directed motor behavior. Let me be a little bit more specific. So what happens when the middle cingulate cortex is damaged? It could be trauma, tumor, infarction. Basically, there is a loss of spontaneous, intended movements. Plus, it can also lead to abnormal posture, right? The third function. The middle cingulate cortex is also responsible for processing negative emotions, right? Negative facial emotions, such as fear, anger, disgust, etc. Plus, it's also responsible for processing negative emotional stimuli. So what happens when the middle cingulate cortex is not functioning or is damaged? It can cause a lot of emotional numbness, right? And the last but not the least is the middle cingulate cortex is also responsible for social interaction. It's responsible for vocalization, right? So when it is damaged, you can see a lot of social isolation or withdrawal, right? So if you look at it, middle cingulate cortex has a lot of different functions, right? And it usually receives most of its information from the anterior cingulate cortex. Now let's talk about the area of the brain that is commonly involved in depression, that is the anterior cingulate cortex, which is called as ACC. Now, if you look at anterior cingulate cortex, it's divided into three different parts, okay? So if you look at, so you guys know where the corpus callosum is. We talked about it. So this is, so just beneath the cingulate cortex, the white matter tract is the corpus callosum, okay? So let me actually point out, this is the red mark here. That is your corpus callosum, and above that is the cingulate cortex, all right? So let's talk about the anterior cingulate cortex. Now you guys know where exactly it is located. So I'll draw this. So you have the corpus callosum, right? So suppose that this is the posterior part of the corpus callosum. This is the anterior part of the corpus callosum. So if we draw the corpus callosum this way, the anterior part of the corpus callosum, there is a bend here, right? That is called as the genu of the corpus callosum because it looks like a knee. And the posterior part of the corpus callosum is the splenium, S-P-L-E-N-I-U-M. So the cingulate cortex, anterior cingulate cortex is right above the corpus callosum, right? The one that is present right above the corpus callosum, it's called as the supracallosal anterior cingulate cortex. A part of this is the dorsal anterior cingulate cortex. I want you guys to remember this because the dorsal anterior cingulate cortex receives information from your lateral orbitofrontal cortex. We talked about it the last section. And the lateral orbitofrontal cortex, as you all remember, is responsible for processing aversive stimuli. So the aversive stimuli is transmitted from the lateral orbitofrontal cortex to the dorsal anterior cingulate cortex. So this is considered to be, in other words, an anti-reward pathway, right? The part of the corpus of the cingulate cortex, right, is right in front of the genu of the corpus callosum. It's called as the pre-genial anterior cingulate cortex, right? Pre means in front, genial is genu, anterior cingulate cortex. What this does is that this usually receives information from the medial orbitofrontal cortex. And we all know that this is responsible for processing reward, right? So the reward is first processed by medial orbitofrontal cortex, which assigns an affective and a rewarding value, right, to the stimuli. Then it transmits it to the pregenial anterior cingulate cortex. The pregenial anterior cingulate cortex, what it does is that it's responsible for controlling what is called as the subgenial anterior cingulate cortex, which is located right here. This particular part that sits right underneath the genu of the corpus callosum. That's why it's called sub, means underneath, genial anterior cingulate cortex. This is a part of what we call as a ventromedial prefrontal cortex, or in animals, it's called as infralimbic prefrontal cortex. The reason I'm actually giving you all these nomenclature is because when you're reading research articles, most of the study is done in animal models, right? So they will talk about infralimbic prefrontal cortex. It is nothing but the ventromedial prefrontal cortex, and the subgenial is a part of it, right? Other part of the ventromedial prefrontal cortex is the medial orbitofrontal cortex, all right? So the subgenial anterior cingulate cortex plays a very important role, especially in controlling the functioning of amygdala. It modulates, let me put it this way, not controlling, it modulates the functioning of the amygdala. And as we all know, the function of the amygdala is recognition of emotion, right? Mostly negative emotions like fear and threat, right? And too much activation of the amygdala can lead to something called as emotional hyperreactivity that we do see, right? We see a lot of emotional hyperreactivity in different psychiatric conditions. The most common that we know is anxiety, panic attacks, right? Increased activation of the amygdala is also seen in manic patients. That's why you see emotional hyperreactivity in those patients. Well, the subgenial anterior cingulate cortex, in very simple terms, we'll talk about this in detail when we talk about depression as well as anxiety disorder. So in short, the subgenial anterior cingulate cortex modulates the functioning of the amygdala. So this is called as the top-down control, right? So it's called as a top-down cognitive control of your emotions. So the dorsolateral prefrontal cortex and the ventrolateral prefrontal cortex will send information to your dorsal anterior cingulate cortex, which is right here, right? Let me see if I can use a different color. So this is the dorsal anterior cingulate cortex right here. Dorsal anterior cingulate cortex, which is under the control of dorsolateral and ventrolateral prefrontal cortex, which then sends information to your pregenial anterior cingulate cortex, which in turn actually controls your subgenial anterior cingulate cortex, which then puts a brake on your amygdala and thus modulating your emotions. So if this top-down control is lost, then you cannot keep a lid on the emotion so that your emotions become contextually inappropriate or socially unacceptable, which we call as anxiety as well as panic attacks, right? So we all get anxious, we all freak out sometimes, right? As long as it's not causing any functional impairment, it's considered to be normal emotions. But once it enters the realm of functional impairment, then we consider it as pathological and we treat them either with therapy or with medications. During the next time, let's talk about other areas of the brain. We'll try to focus on actually how subgenial anterior cingulate cortex modulates the functioning of the amygdala. There's a very nice article actually on this particular topic, but we'll talk about how stress disrupts this particular communication and precipitates anxiety. Thank you.